so we can go ahead and get started. Hello again, and thank you for joining today's webinar, Practice Managers, Your Telemedicine Playbook, presented by Anytime Pediatrics. This presentation will be recorded today, and all of you attendees will receive a recording of the presentation tomorrow, which you're welcome to view and share with others. This will be an interactive webinar, so feel free to enter some questions in the chat as we go, and we'll have some time for questions and answers at the end. All right, so I will start off by introducing our panelists. We have Angie Connors joining us from Anytime Pediatrics today. She is the COO and co-founder of Anytime and has had years of practice management experience. And next we have Mary Lou Marotta from Pediatric Health Associates, a part of Allied Physicians Group. She works as the office manager at Pediatric Health Associates, and we are very excited to have her join us again. We'll also have Mary Ann from Pediatric Health Associates jumping in to tell us a little bit about telehealth billing. She specializes in billing at Pediatric Health Associates, so we're excited to have her join us as well. And finally, we have Lydia Hernandez, a medical assistant at Larchmont Pediatrics, joining us to share how they manage telemedicine at their practice. Thank you so much for joining. We're excited to have you all with us today. So I will hand it off to Angie to get started.
Thanks, Darby. We are super excited to be here, but most importantly, I'm super excited to have the practices here because they are the experts, because they're using it every day. So it's going to be a great presentation. And really, we're going to talk about how a lot of different things. So I hope you guys ask questions and things like that, but probably a lot of you guys jumped in and started telehealth very quickly last year. And we even talk to practices right now who have never used telehealth. We're not sure what they did for the last 18 months. So kind of preparing your practice may be a little bit repetitive, but I think it's really kind of important to go through this because everybody did it last March. But I think there's what you'll hear from some of our experts today is there's a great way to do it. And I think the first and one of the most important things is identifying that champion, right? To think about who in the practice really is a proponent for telehealth. Sometimes that's the practice manager. Sometimes they can be that change agent. A lot of times it's the owner or maybe one of the partners in the practice. We work with practices that sometimes that's a new pediatrician who says, I really think that we could do this and brings the others along with them. But having that champion really kind of helps gets everybody on board. Determine your state's telehealth rules and regulations. Well, that was really key 2 years ago. Right now it's chaos, but that's still really important because we know that eventually we're going to have to follow what those state rules and regulations are. And it's always important to know that and think about that down the road. Establishing workflows and features, to me, that's one of the most important, right? You know my background. I think that one of the most important things is knowing and understanding how this works for my practice, right? Every practice is different, so thinking about that is key. Training your staff, whether it's a new phone system or telehealth or a new way to do something is always important. Messaging with your team, so not only they feel comfortable with telehealth, but they also feel comfortable discussing it with parents and patients. Lastly, establish your goals, right? If we're going to do something new, we have to have a reason we're going to do it. We're going to have a way that we can look and decide that we've been successful, or maybe we need to make improvements, but really knowing what your goals are. We do a lot of discussion at Anytime about KPIs. What's our key performance? Do we have certain targets we want to meet? And lastly, that initial rollout. So, and notice I say initial because once we've rolled it out, we're going to look at it and assess it. Are we doing well? Do we need to make changes? And then keep going. So how to prepare your practice. To me, as I mentioned, this is one of the most important things, and that's your workflows. What type of visits are we going to have? Is everybody going to get a scheduled appointment? Is that going to be scheduled in our EMR? Is it going to be scheduled in the Anytime system? Are we going to do virtual walk-ins, right? That's really important to think about. How am I going to do this? Are they scheduled at certain times during the day? Or are we going to have a block? Or do we just use them as a fill-in? Really thinking about that workflow. And I think you'll hear from Lydia and Mary Lou, every practice is different, right? You have to think about what's working for you or what would work for you. But also you've got to have that flexibility to be able to say, right now it's fall, kids are going back to school. We're going to do walk-ins from 3 to 5 in the afternoon because we know kids are coming home. or maybe we want to do walk-ins at 8 in the morning for that on demand. And so it's really thinking about what works and also reassessing that. And the next thing to think about is, how are we going to use the technology, right? Are the pediatricians going to have a dedicated space? Are they going to use their desktop? You know, we work with some pediatricians who go into an exam room, they use a tablet, they have their EMR on a computer. What's the technology? And as we'll talk about in a minute, making sure all that works and training your staff on that. What type of visits, right? Every practice is different. I'm excited because the practice managers today, they both use it differently. They both have different visit types they're comfortable with. And that's a lot driven by your pediatricians, but there's a lot of different visits you can use. And finally, communicating that not only with your practice, but also with your patients, right? If you're going to have every med check be via telehealth, you need to let your patients know that. So to me, this whole workflow and preparation is really one of the most crucial parts. Communication. So as you guys all know, if you're a practice manager or if you're a partner or a pediatrician, you probably can't communicate enough, right? Change is always something that people get a little hesitant on. But really, one of the things to talk about is why you're adopting telehealth and why it's important, right? We saw a year and a half ago, everybody needed telehealth. So one is practice survival. And we've really seen that it does provide better care for patients, the ability to triage them via video, to see the cut, to see the rash. It also helps with your patient retention, right? If I know I can talk to my pediatrician and I can see them, I'm going to go to them first. And also, you know, offering telehealth when others aren't thinking about it, it really makes your patients know that you're innovative, you're looking for the best ways to deliver care. Why would you think that Anytime would be the right thing, and why we want you to, you know, talk to your patients about it is that, you know, we utilize everybody, right? All the pediatricians on our platform are constantly giving us feedback as to what they want to see, what they need, and what will make them successful. And as I mentioned, there's a lot you can do to match what Anytime does to your workflows. And we also really believe that by utilizing some of the features and functions, we've got the facts and figures that show you can really grow your revenue within your practice. So preparing for telemedicine, I think, is this still mine or is this Mary Lou? This is Mary Lou, isn't it?
Yes.
All right. We always say it's never a meeting until you have to tell someone to unmute.
Okay. Hi, everybody. This is sort of our little focus around here. This was very, very important. You know, getting everybody on board, be it the physicians, who, you know, I'm sure like in any practice, you have the go-to people and then the people who are a tad resistant to anything new. So it's sort of the coaxing, hand-holding, you know, getting everybody kind of on board with it. As far as my staff, I think everybody got very comfortable with it. Most of the staff, we all, you know, downloaded to our phones so we could kind of practice, because I think it's really important for you to see what they see. So you know, so they feel very comfortable on the phone explaining the process to them. You know, like you hear everybody around here say, you know, we scheduled you for an appointment. Don't forget to look at the bottom of the little calendar, you know, the red dot, you know, so it's a very visual kind of thing because we've done it, so we can talk them through it. I think that's really important. So, yeah, that was kind of the big thing. And as far as, you know, just pushing it out there, I guess we'll talk about that later, how we kind of advertised it. But, and the visit types, again, in our practice, we kind of do it for pretty much everything. Anything that's a visual lends towards telemedicine, be it, you know, pink eye, be it, you know, abrasions, you know, any kind of contusions, that kind of thing. We use it for, you know, ADHD med follow-ups. Any kind of med follow-up actually can be done that way. What else am I forgetting? Rashes are very big, especially for newborns. Diaper rashes is a big thing. Actually, when I talk to new parents that want to join our practice, the minute I say we do telemedicine, they're very excited about that because they're young and they embrace, you know, all of this. Nutrition follow-ups are that way. So yeah, it's a really good platform for those kind of things. As far as the internal communication, at the end of every of my emails, and I do a lot of emailing all day long, at the bottom of my thing, I have a blast advertising, have you downloaded Anytime? It's right on every single email that goes out. So they're constantly getting hit with download the app, download the app. You know, and I think that makes a difference, you know, that they see it and it's in the forefront of their minds, you know, for our practice.
Okay, and when are you going? When are you leaving for school?
Hi guys, good morning. So pretty much for our practice, we weren't doing telemedicine until COVID. I know we were doing a lot of well visits, six patients mixed in between pre-COVID. But then we really went into, patients didn't want to come into the office, like a lot of our well visits, especially because we're very baby heavy, like from 0, I'm going to say to 2 years of age is like where our big main focus is on. So a lot of patients didn't want to come in. They were scared to come in. So that's when we really pushed in for the telemedicine. The only thing we don't do on telemedicine is the well visits, because, you know, it really takes having to weigh the baby, the measurements, all of that stuff. We also do developmental questionnaires for every single well visit. And then at a certain age, we do like mental health questionnaires where it really like introduces everything to the patient. So it's really hard to get that information via telemedicine. But we really do offer it for everything else. At first, we weren't seeing any cold symptoms or like any related COVID patients in the office, because of course we wanted to keep our newborns as safe as possible, try to make everyone and new parents comfortable with still coming in the office. And the way that we do it is where we were seeing all their well visits in the morning, and then in the afternoon, we started doing that chunk of telemedicines. And if patients needed to be seen, if like the doctor did their initial visit and they thought that it was safe for them to come in, then we'd have them come in later in the afternoon. So like our sick visits start like around 3:30 to 4 in person. Also, we weren't testing in the office, so we'd have to see them to write the lab slip, and then we'd send them over to Children's Hospital. So everything is just, it was changing constantly. Onboarding the staff was pretty easy because everything ever since COVID has been changing. So we've had to like be on our feet constantly. Like it could be 1 week this happens, and then the next week this happens, and like with all the regulations. So it was really just getting the workflow. So the way that we do it is everyone has the exact same workflow. We like to call it musical chairs, where everyone is cross-trained in the front, in the back, doing telemedicines. So really, my practice manager, Diane, and myself, we did the training, we watched the videos. We have, my child comes to this practice like for sick visits. So I really use my child's portal, I guess, so that we can use it as a practice and see what the patients see. Because it's really helpful, like when you're on the phone with the patient and they're like, hey, I got this email. And you're like, okay, read to me what the email says, you know, and we know what the email says and what is to follow. So what I did personally was I signed up for everything. I did it as a new patient, as an established patient, printed out the emails, and then like kind of like memorized it. What's the step by step, and just walking the patient through it. And once we came up with the same workflow for everyone, like it's really like impossible to like make any mistakes because everyone's on the same base by base and everything. In regards to deciding the appointment types, it really helps like being more flexible because, you know, with new parents and like little ones, it's hard to like have to leave one at home and bring one in. So it gives like more availability to every.
I think we lost Lydia.
So on the top right, you'll see it says portal. Once you click that, you use your username and password for that. And
That-
that's on there.
There she goes.
It'll say safe.
Can you guys hear me?
We can hear you now.
Okay, I don't know what was the last thing you guys heard, but I was saying the telemedicine, it really opens up some availability for all the patients to be able to either come in the morning or be able to be seen in the afternoon. I know there's a lot of patients who don't have childcare, so it really just gives availability for everyone to be able to be seen, especially for new parents who have questions about, feeding and like Mary Lou said, diaper changes and is the formula that I'm giving is okay, am I breastfeeding enough? So, and they're constantly coming in, like let's say they're coming in like twice a week. It's really tough for them just to come in again for some questions. So it really opens up availability for everyone. Internal communication, we do like our monthly emails with our patients and we just give them updates of what is to happen or what is to follow. So we're constantly reminding them we have telemedicine available. We're available for you guys. Send us a message. We have a patient portal and we're letting them know we're constantly communicating with them back and forth and letting them know like we're available for telemedicine or in person, whatever you guys feel more comfortable with. So it's just really everyone being on the same page and then deciding what works for the parent and the patient and everyone else,
If I can add to that, I think it's also an important thing that parents feel the comfort of that, because it's really nice to touch base for any reason, especially with a newborn and a young child, with your trusted pediatrician. And it's nice that the doctors have access to them, from home, from anywhere. It can be done anywhere. They do it on their phones, they do it on their tablets. That's the great thing about telemedicine.
Yeah, we also have patients who are, let's say, once the restrictions were kind of lifted, they started traveling. Like they would go visit grandparents now that everyone started getting vaccinated, and they were away from where they live here in our pediatrician's office, and they can't see a pediatrician where they're visiting because they're only there for like a week. So we were able to touch bases with them, like send us a detailed email on what your questions are. If it's a rash, a pink eye, an injury, anything that it is, please send us the message. I mean, we also encourage them. It's really awesome that Anytime allows you to upload the pictures while you're on the telemedicine. So the doctors can see them, not only like if they send us a picture from like a day ago and the rash really changed from the next day, you're able to upload the pictures and the doctors can see how the difference is from yesterday to today. And it really just gives them that comfort of we're always there for them.
And you can save those pictures, which is awesome. You can actually move the pictures into the EMR, which is awesome.
I know, and the app has like, well, not even on the app, but also if you're on the computer, it gives you the options to chat with the patient. So the way that it works is we put the patient on the schedule on our ER system, and then Anytime takes care of everything else. And we just call them and we let them know like, hey, 10 minutes before the appointment, we always let them know we're going to call you 10 minutes before the appointment. If they have any questions, we walk them through, this is how it is, give access to your camera, and it gives us that time to get them ready. We also ask them as the MA, any allergies, any medication, all of that stuff that goes into the visit, and we mark it for the location, and then we mark the patient ready. A lot of the times the patients put like their phone on mute because they're scared to miss the appointment. So we're able to chat with them on the messages like, hey, we're trying to contact you, please call the office, or I'm going to call you shortly, please make sure that you answer. We want to get you guys ready for your telemedicine. So it really helps, like it's a constant communication before the appointment, during the appointment. I know sometimes if the doctor is running late, we can we can send them a message and be like, doctor's running 5 minutes late, please give them a couple more minutes. I know somebody's asking about our monthly letters to the families. So we have all of our patients, they have to sign up with an email. So because we're constantly, like I said, emailing them back, and they have to have an email to set up for the Anytime account. So what we do is like every 5th of the month, I guess, we come up with updates and we let them know like, hey, there's new OSHA regulations, there's new updates on the vaccine, there's new updates for the office. And we just kind of put everyone into perspective of what is to come for that month. I know for like example, this month, everyone was getting ready for school. So we kind of started letting everyone know like the updates for the vaccine. I know because it was changing. I know they were saying 16-year-olds can get vaccinated and then 12-year-olds can get vaccinated. So all of those updates go into our monthly emails. And then we let them know like our telemedicine is available and what is to follow for the telemedicine. So just minor details. so that everyone knows that when a patient calls, like everyone is aware of what is expected from the patient and from the practice.
Yeah. Thanks, Lydia. So I think these guys did a great job. It's like they teed me up, but really common use cases for telehealth. And, you know, I think the travel is a big one right now, and it was. And so, you know, there's a lot of just kind of different types of consultations you can do. You know, I know Allied has a specific group of lactation consultants that they can bring into the visit and use. But a lot of the follow-ups are also good ways to use telehealth. And we can talk about it a little bit more, but when you look at the ADHD, the anxiety, depression, the asthma, so many of the pediatricians we work with talk about the fact that they like to do those follow-ups from home because, one, you can see the environment, right? You can see the child's room, you can see their bathroom, you can see, you know, think about asthma. They can see if there's shag carpet, and they can see that grandpa's smoking or different things that are affecting that asthma that they're not going to see when they come in the office. And one of the pediatrician doctors we worked with on a webinar said he absolutely prefers some of his behavioral health follow-ups, at least one or two, to be via telehealth, because that patient in their room without their mom standing outside the door of the exam room is so much more likely to tell how they truly feel about what's going on, about how the medication is working. So those routine follow-ups are just so well served via telehealth. And as you can see, those sick visits are really changing because a lot, like Mary Lou talks about, a lot of the visual, but also right now with COVID, bringing in some of those other things via telehealth is a great way to use your telehealth platform. So training and support. So, go ahead, Mary Lou.
I was just going to add to what you said. We, at this practice, we use it for before somebody gets tested. We do a telemed first, just to hear the story of, like, you know, how they were, you know, supposedly exposed and whatever. So we use that as a pre-COVID testing.
That's a great way to do it. And especially now when people are so hesitant to come in, it's a great way. And, you know, we've talked a lot at Anytime. I mean, bringing patients in is expensive right now, right? All the changing of, you know, there was always cleaning, but it's to a different level now that it's expensive. So if you don't need to bring a patient in, that's overhead you don't need to spend.
I also want to add to the anxiety, depression, and all of that. The way that we book, like I said, we separate our visits and we try to keep the doctors on well visits, sick visits, telemedicine, but it also opens availability for the doctors. So like, let's say they need like a 30-minute slot for a patient of follow-up for the anxiety and the depression or the ADHD. We have that availability to schedule it either the last before lunch or the last before the end of the day. That way the doctor can spend as much time as needed with the patient without having to like think of the other patients that are waiting for them. So it really opens up, like I said, for the patient and for the doctor to be able to give that extra time with the patient and address all their needs. That
is a great tip. That's why I personally love these webinars, because the tips that you guys have about what you're doing, like is pre-screening COVID and the extra time for the ADHD, you know, you only learn those when you're doing it, right? And so that's personally why I love these webinars with the practice managers, because everybody shares such good ideas. So next about training, just quickly, we offer really kind of 2 training sessions every week that anyone can join. So if you have a new clinician joining your practice, or a new administrator, they can join those trainings live. But we also have just an entire library. If you haven't met Eileen Foley, she does most of our training. She also runs our support team, the nicest person you'll ever know, in my humble opinion. And she does all our training videos. So those are always available on demand. For anybody who needs them. There's also parent resources. So on our help site, your parents can go there to get help. Hey, I can't connect or whatever. And we also have live support Monday through Friday. And that is Eileen or someone else on our staff who can really help out not only your staff and your clinicians, but also parents, right? So we saw a little uptick in our tickets last week, but it was a lot of parents who were first-time users, and for whatever reason, they needed help, and we're there to actually help you guys and support you. So patient communication, this is one of, to my opinion, and I think Lydia and Mary Lou have emphasized this, really one of the most important parts to being successful. So what to consider? I'm going to talk briefly about this because these guys have already done it and they've done a great job. But there are a lot of ways to communicate. These guys are, well, these practices are communicating electronically, right? You're talking, you use email, you use e-blast. It's also a great opportunity when people are checking out. Hey, you know, it looks like you need to follow up in 2 weeks. We'd love to do that via telehealth. I think every one of these different ways to communicate telehealth to your practice and your patients, Lydia and Mary Lou have really already talked about in their examples, right? And I think it's why they're so successful, not only in how they do it today, but also being able to adapt. So what you need to let your patients know, right? And when you're available for telehealth. Like I said, some practices like scheduled visits. So you want to make sure, hey, we schedule all our visits. Call the office and we'll schedule you. Or if you're open for virtual walk-ins, these are the hours we're open. It's a great thing to put on your website, letting them know what you treat via telehealth, right? Hey, we're not going to see you for, a well child via telehealth, that we'd like to have you come in the office. Lydia talked about this too, the travel, not only when you're traveling away, but also when, you have parents who don't live close to your office. For some of them, it's hard for them to get there via transportation issues or other things, bringing in siblings. So avoiding that travel telehealth is really important. And it's also a great way to keep parents involved, right? So when you've got one parent who lives, maybe you have split parents, telehealth is a great way for both of them to be on that telehealth visit. So there's a lot of reasons you can communicate with your patients that you're offering telehealth. So we talked about a few of these, but I think I'll just go through them real quick because both Mary Lou and Lydia are going to talk about their outreach, but you can do e-blasts. Some people use text messages. Now, some text messages automatically come from the Anytime platform. For instance, if your patient has a scheduled visit, they're going to get a text 10 minutes before reminding them. We have some practices that actually use some direct mail. You could always do a webinar. We have a practice in North Carolina that is awesome on social media. So every Saturday morning, they do walk-ins for telehealth, and you're going to see them on Facebook every Saturday morning. Just reminding you, we're open and available before you jump in the car or go somewhere else. We're here. In-office messaging, I know Allied uses that a lot. It's a great way to communicate. And also, one of my practices I've worked with for a really long time in Florida, the first thing you hear when you call their phone is, we now offer telehealth, right? So it's a great way on your phone trees and your answering service to let them know that you're offering telehealth. So what do you want to communicate with your patients? This is great. This is what I'm going to turn over to Mary Lou.
Well, on our websites, it's got, I really loved about it, actually. I think we actually got it from you guys. We put the step-by-step of what they do to register, for Anytime. I mean, it is pretty easy to use, but it's, you just, when you dial our main office, there is a separate line for telehealth visits. They press option 3, I think it is, to do a telehealth visit. And again, I think it's just really important that your staff be very knowledgeable about the steps for registering, and being able to help the patient through it. I think it makes them feel better when they're getting some guidance. I mean, my office, if somebody's really having a hard time, we have no problem just jumping in, registering them, and then just pushing it to them. We've been known to just add other siblings when they forgot to add a child in. Just do it yourself. It's fast, it's easy, just get it done. After hours, again, thanks to, Allied was very fortunate that we have physicians that are on from 7 to 10:30 every night, other than my particular physicians, who pick up the slack for all of Allied, and they do those visits. So that's really a nice thing too. It saves visits to the urgent care centers. You want to keep them in your own practice, not going elsewhere. Exactly. They can, and because we're on demand all day long, they can just request visits as they need, which is a nice thing to be able to do. You want to talk about the cost?
Well, in addition, with the telemed right now, especially with COVID, a lot of the insurance companies, if you're doing telemed, will waive the copays. As if you come into the office, you're paying your copay. So that's also a nice little thing with the telemed. Even some of them with deductibles, and we still have one or two that are even paying that if it's COVID related, that they're covering it. So, which is nice. You're not paying the copay. If you come in, there's always that copay. With some telemeds, they're still waiving those copays if they're doing it, you know, through telehealth, especially if it's COVID related. But it gets billed the same way as a regular office visit. So they're not paying more. Some of them think that they're not going to be covered, but it's getting processed the same way coming to the office would be, which is nice for the practice too, because you're also getting paid the same amount you would if they came into the office, which is a great perk.
Mary Lou, do you want to talk a little bit about the contest that you did to help patients get registered?
My goodness. Okay, blast from the past there, Angie. Okay. When we first came on board to get our patients on, we had within Allied, a little contest for the offices to see who could get their patients onto the app faster. Well, we did really well. Because I'm a little pushy. Anyway, but yeah, it was fun. You know, the staff got into it, and you know, it was fun just watching the numbers go up and up and up. So that was a cool thing just to do. And again, the educating the parents. You know what? Again, it has to be constant. You know, I mean, you know, because you'll have, you know, we always get a lot of new, you know, parents coming in, and it just has to be that it's part of our being. You know, they have to know telemedicine is part of PHA. It goes with any other kind of visit we do. And it's just a nice option for them.
Yeah.
It really is. It's a great thing.
Yeah. And I think Mary Lou might have won. So just in
You
case.
did.
Yeah, I knew that.
Alrighty. So yeah, like I said, our patient communication is one of the biggest. I'm gonna say it's like 90% of what, you know, it takes into getting the patient to do the telemedicine. You have to let the patients know like what they're offering. So like I said, before COVID, we weren't really doing a lot of telemedicines. We had a lot of where we would message the doctor and then the doctor would get back to the patient after hours. But when COVID hit, it was an insane amount of calls of just everyone having questions, because everything was so new for everyone. So it was really impossible like for the doctor to get back to everyone in a timely manner. So we really just like let the patient know, like if you expect a call from the doctor, if it's an urgent question, you know, so we kind of started to know if you have more than one question, we can give you a scheduled time. You can spend that time with the doctor and you can get your questions answered right then and there at that moment, waiting 40 minutes versus having to wait 4 hours after hours, you know. The direct patient outreach, like I said, we do our monthly emails. We're very community-based. We're here in Larchmont in LA, so it's like it's not a little town, but everyone knows each other. We have patients who refer their families, or they heard of us from a mommy group. So it's really about having to get out there and letting our patients know, like, hey, we have telemedicine. And like they say, word of mouth. So like they would say, like, our doctor has same-day telemedicine visits. They have same-day sick visits, and they're very flexible with if you can't come in or you don't have that chance to like come over right away or at the time that it's scheduled. You know, so it's getting everyone, informing all of our current patients so that they can let everyone else know. And our new patients are also coming already ready, letting them know, like, it's not nothing new for them. It's already established, like we have telemedicine available for them. And like with all the changes, like I said, we constantly send our emails out. We have our social media where we post things. With COVID, we had been posting a lot of updates, and we send out, schedule your telemedicine. It's easy to schedule your telemedicine, like step by step on our social media. So it really got out there. And like I said, we have our patients who follow us and they repost it and it gets around to everyone. So it's really helpful. Letting the patients know and getting them on board. Like I said, we really, we did our training. I did it from the patient's view as an established patient. We also did it as a new patient. And it kind of gives you that, what are the patients looking at? And telemedicine was new for a lot of people. You'd be surprised, not a lot of people were doing like telemedicines before COVID. So people were like, I don't know what this is. Is it a phone call? I'm like, it's a video chat appointment. We're gonna download this app. And like I said, we went through the emails, we printed them out for ourselves so we can see what the patients are looking at and what they're expecting, so that they know that we know what we're doing. And then if they're going through it, we can help them out through it and walk them through the process of everything. And then what was the last one? If we can go back. Yeah, and then just the ongoing communication, constantly staying with the changes. So I know that Anytime sends us like our telemedicine tips. So we go through those emails when we get them, like telemedicine Tuesday tips, we review them. There's some things that we find out about because we're at the moment and it happens. So we're trying to figure it out, but it's really helpful to go back to those telemedicine tips and like, oh, this happened to us last time, or I know about this, and like letting the patient know if this happens or if you're having any issue with this, and then do this. And we have the tips for them. Because a lot of times, like I said, we did do it ourselves, but there's unexpected, things that happen, technical difficulties that we don't know or that the patient is not aware about. So we go through those tips and we let them know. And I know like anytime we have any questions, we call Anytime Pediatrics, like, hey, can you guys help us on that helpline desk? And they're really great about getting back to us and solving it so that the next time that problem comes up, we know how to fix it. And it's just ongoing communication, not only with the patients, but within the staff, because we all do telemedicines here. Sometimes one of the MAs will do it, and then the next day it's another MA to do it. And it's like constantly staying in the loop of like, hey, if this happens, you guys know what to do.
So true. The staff becomes very IT little gurus now. They can handle a lot of things.
Okay, so this will be, billing 101. So I always hesitate to give billing advice, right? Because it's different in every state, it's different with every payer, but we're going to just kind of give a little bit of a high level overview to talk a little bit about it with Mary Ann's help, because she's the day-to-day expert. Licensure, right? So, one thing that's key to know that just like telehealth is like being licensed for anything else. If you're going to practice telehealth in New York, you have to be licensed in New York. If your patients live in New Jersey, then you need to be licensed in New Jersey for telehealth too. So it is important to kind of look at that. I will say one thing that I would encourage everybody to look into is those kids away from college, right? So when you have your kids and they go to college, depending on your malpractice and your payers, a lot of them will say, well, even though they live in New York, but they're going to college in Tennessee, we will allow you to treat them, right? You don't need to be licensed in Tennessee. And that's really kind of something that each practice should look into, is those, or like Lydia mentioned, patients on vacation. Most carriers for malpractice and payers will say if they are a part of your medical home, they are an established patient, you can treat them via telehealth when they're not located in the state. But I am sure that conversation's probably already been had, but that's something to just kind of check on. Reimbursement. So there's really, as everybody on this call has talked about, there's kind of three ways to look at it. And billing insurance right now is the way to do it, right? Because if you're not getting paid, then you're not billing right, because everybody's paying for telehealth. It's still today. And I had somebody reach out and say, no, I don't think they're paying for telehealth. I'm like, no, they really are. And I think the other thing to really check into on billing insurance is, if pre-COVID your state was not paying for telehealth, there's a very good chance they have either changed that legislation or they're working on that. And we're going to talk about some resources for that at the end of this. But really, I encourage everybody to stay on top of what their payers are paying, not only for private, but also for Medicaid. There are some options where people say, hey, we're just going to do a flat out of pocket. And then some practices, depending on the community and the payer, they do offer it for free if it's not covered by insurance.
I've been seeing most of them are covered. For the most part here, everybody's paying.
Yeah.
It's a matter of billing it correctly with the right modifier and place of service. Each payer is different. So you need to know which payer wants it billed which way. And for the most part, they're paying at the same rate as they would as an in-office visit.
Right, and that parity law I just read today was, I think, extended at least, I want to say almost through, it might have been in California, it was extended through 2022, the parity law for telehealth. And Darby, if you don't mind, let's just skip to that next one, because I think it really talks about the reimbursement. One more, sorry to jump around on you, but I think this slide is really to me, this is the meat. And that's what Mary Ann was talking about, is you've got to code it right. And if you do that, and you won't get denied, but really it's usually telehealth is either a 991 it's either a new patient, right, who called in, a 99201 to 205, or it's a 99211 through 215. And a lot of that depends upon which code that is. That depends on the length of the visit, the different things. Your billers are experts at that, but that place of service code 02 means the patient is at home. Right. So, and then the modifier is one of those things that depends on your state. So that's where I would encourage you to look on your state. We're going to give some resources at the end that will tell you where to look at that. But if you look at the state, that is where you'll find out whether yours is a 95 or it's a GT.
There are, though, a lot of payers that are not using the place of service 02. So you do have to look at your payer contracts. There are some that still want the place of service at 11, still, but with the modifier attached to it. So you have to check each payer individually.
To add to that, so part of our workflow is when we call the patient and ask them about their medications and their allergies. On there, it gives us the option of who's doing the telemedicine or who's doing the visit. And at the bottom, it says location of patient and location of provider. So we always go in there and make sure that that's done before the doctor starts the visit and starts with the notes. So it just makes it helpful, making it part of your workflow so it does not get missed, because you're already going through initial questions. You can already change it on there. So it really helps to get started before the doctor goes in there.
We have our system set up where if it's a telemed, you open it up as a telehealth and the system automatically adds the correct modifier. So when it's billed, we don't have to think about it. It's automatically getting billed with the modifier, and it's just a matter of making sure the place of service is correct. So depending on what system you're using, you can even set it up that way.
All right, Darby, will you skip back one for me? Sorry, this is my favorite, but documentation, a couple of things are key. One is and I know this happened with Allied in the very beginning, was they asked for that, can you prove a consent to treat, right? So knowing that you have a signed consent to treat, it's one of the things we always talk about within Anytime, is you've always got proof of that, because they might come back and ask about that later, right? So the other thing is the length of the visit, right? So knowing how long they were with that patient, time is now one of the things that can change that complaint. Is really so documentation, and just like Lydia and Marianne said, knowing some of this stuff before you implement telehealth makes you more successful, right? Because there's nothing worse as a practice manager or a biller than coming back and finding claims 30 days from now and trying to figure out why they weren't paid, right? So knowing and researching these things beforehand is really key. All right, now you can go back, Darby, to where we're supposed to be. And these are the resources, and I think Darby put something in the chat, but I'll tell you where my favorite resource is, and that's the Center for Connected Health Policy. Because at Anytime we support people at every state, and that they break down everything, not only as to what's current law in the state for your private payers and Medicaid, but they also tell you what legislation is pending. So for those of you, like I just said, there was a lot of changes in California that I think just happened. I got an email blast for the Center for Connected Health Policy to tell me what was changed. So there's a lot of great resources. The AMA has some great billing and coding resources. There's a lot of licensure information. There's compact states. So all of these are great places, but I can tell you I'm biased towards that Center for Connected Health Policy, because I feel like they really break it down per state by payer type. All right, Marian, we're going to turn it over to you for all your tips and tricks. Mary Lou, you're on mute though.
Well, I mean, pretty much, it's pretty basic. If it's, like I said, when we open up a visit, when we know we have a telemed, we have a special template for that. So it automatically fills out, it documents it, but you know that it's a telehealth visit. You should be documenting in there that you're seeing the patient via telehealth. And it's really billing and knowing each payer and just billing those modifiers and those places of service correctly. That's the key. And like I said, each payer and CMS, they're different. So some of them want the GT. There's a few that want the 95. The majority of them, I would say, is O2, but there's still like 3 or 4 of them that we're still billing with a place of service of 11. So you have to know which each payer and what contracts, what they're stating and how they want you to bill it. But for the most part, most of them are not charging a copay for telehealth. They're waiving that for the patients, and the insurance companies are paying it. Especially, and if things are COVID related, some of them are even paying the deductibles depending on the reason. So right now, a lot of stuff being COVID related, it's really great on the patient's point, because a lot of people will call, well, I'm doing a telehealth. Is it covered under my insurance, and how is it billed? And it's billed the same way. It's just a matter of the modifier and the place of service.
Great.
But I'm also seeing everybody's paying pretty much at the same rate, which is also nice.
Yep.
And if they don't, we charge a flat fee. So if there's those few in between, we charge one flat fee for it. And the patient sign that waiver at check-in.
Yeah, and for those of you who don't know the telehealth lingo, that's a parity law. So if you're ever looking for Center for Connected Health Policy and it talks about parity, that's a big win when you have a parity law, because it says that you have to be paid the same for a telehealth as you do for an in-person, right? So as Mary Ann talked about, that parity law, some places that's law by state, that you can't be paid less just because you did a visit via telehealth. So how to expand your telehealth practice. So I think these guys did a great job of talking about how flexible they've been, right? I think that, this is Lydia's slide anyways, but I think that they have all done a great job of really showing you that you have to be flexible. And I think being adaptable is key.
Yeah. So just the scheduling workflow, I know it's changed. We try to fix it so that it's, if something works. So the way that we do it is we always see our well visits in the morning. Our little ones, our newborns. We also block spaces because we don't know how many babies are going to be born overnight. We can't see the future. So we hold specific spaces for newborns, like newborn 1, 2, and 3, up to like even 4 newborns. Depending on how many spaces those get used, if they don't, then we turn that into telehealth, where we see all our well visits. We give like a little chunk of time for them to catch up just in case they're running behind or a patient ran behind. And then we start booking your telemedicines. Those are the very first morning appointments. So like I said, if the doctor sees that the patient does need to come in the afternoon, they do that initial visit with the telemedicine, and then we're able to bring them in the afternoon for a visit. And it's just one visit that we do bill for one day. So it's not like we're billing 2 different ones, but at least it gives the patient that comfort of like, we saw you in the morning, we gave you the recommendations, now we can have you come in the afternoon. Or if they need to be sent somewhere else, we let them know like, hey, it's urgent that you go somewhere else, but we already had that communication with them. So the workflow, that's pretty much how it works. We have our doctor who is, one doctor does well visits all day, and then the other doctor does well visits in the morning, telemedicine right after lunch, and then we have that same doctor do the sick visits starting 3:30 until 4:50. I think that's the way that it works. And yeah, like I said, we split it from morning to afternoon. And then I don't think it's going to be a seasonal use. I think it worked. The telemedicine really worked for everyone. And it's just like changing it base to base to see what works for everyone, like for the doctors, the providers, and the patients. So I don't think it's going to be just for now. I think it's something that's going to stay because it really benefits everyone in general. Like I said, now we're testing in the office, but we have patients who don't want to come into the office and they live really close to where the hospital is at. So we're still able to do that telemedicine for them in the morning. and then they can go and get tested whenever they can, or whenever it fits their schedule for that same day or the next day over at the hospital, at Children's Hospital, which is where the drive-through for the COVID testing is at. So it's just the workflow for everyone. If we see something isn't working for either the provider or the patient, like we see, like let's say we're doing too many well visits in the morning and it's making our telemedicines wait too much in the afternoon, we're able to budge in some catch-up time. Or if like we do 4 telemedicines back to back, then we do a little like 10-minute catch-up so the doctor can like catch their breath and then do that. Yeah. One thing we have noticed the doctors were telling me was like, we're doing like 10 telemedicines back to back. It gets kind of draining. So we're trying to figure something out where we can like still do the telemedicines and then give them a break. But it's really hard because like we were talking about last time, we're getting a lot of, it's like flu season in the middle of summer. So we're really just trying to get everyone seen in an appropriate time on the same day and address everyone's questions. So it's just adjusting the workflow for everyone. But for now, that's the way that we do it. We have one doctor who is our well doctor all day. And then the other doctor is well in the morning, telemedicine after lunch, and then sick in the afternoon.
I feel, Bill, now I feel like I abuse our physicians. Sorry. Because we're on demand. So we start at 8 o'clock, it goes till 7 o'clock at night. And how we do it, Lydia, I told you I would kill to do your schedule, but that's not going to work. So we do wells all day long. So how we do telemed is we, if there's an 8 o'clock well, say for instance, then we'll put a telemed next to it. So while the thinking is that while the nurses are working up the patient for the well, the doctor's doing the telemed. Again, some days they do need roller skates because they're going kind of back and forth. Whoops. Oh no. Okay. But they're booked like all day long. And, again, my doctors do prefer if we can do a couple of telemed together. This way they can stay put for 5 minutes, 10 minutes. They kind of like that and appreciate it, but they really are doing it all day long.
So what we've been doing is with our well visits, it's really hard to budge in our telemedicines because so we have the patient come in before the appointment because they have to do their developmental questionnaires or mental health questionnaires. So that takes them about 20 minutes to complete. And then the nurse goes in there, does the vitals, does the whole shebang that they have to do. If they need ice cream, lead testing, all of that takes like another time. So then the doctor really goes in there. It's like 20 minutes past the time that they're already scheduled. But it's really hard to try to budge in because we have our patients back to back on their well visits. So while the doctor is already into the first patient, then their nurse is already vitaling and doing everything that they have to do for the next one. That's where it gets kind of tricky with the well visits for us. But what we have been doing is like, let's say we have our telemedicine at 3:50 and 4 o'clock. We have our sick patient come in and check in at 3:50 so that we can vital them. And if we need to collect whatever it is that we need to collect, they're vitaled and ready to go by the time the doctor is done with their next 2 10-minute telemedicines. The sick patient that's in the office is marked ready to go. So it's kind of just like messing. It's a lot easier with their sick visits because they don't have to do a lot of things before the appointment where it's like we get them vital, what's going on, and then we go versus having to do everything else. But we have been trying to budget in where it's like we do the telemedicine and then have the sick patient come in earlier so we can get them vital and ready to go. That kind of has been working out. And like I said, because we're getting a lot of sick patients coming in and now that it's like we're running out of space to come in, so we're trying to like double book everything. It's a lot easier to do in the afternoon than it is to do in the morning. But if we could, we would do telemedicines and well visits, but it's just so hard because then if the patient, like let's say a patient runs behind on their well visit, now the whole schedule's backed up. Now the telemedicine is waiting, and then that's not okay either for the patient or for the provider either. So it's really having to try to stay on schedule and try to fit everyone all at once.
Yes. And what the beauty also I think of telemedicine is just in practicality. I mean, what's better than, okay, you have a 3:15 telemed, but the doctor's backed up, but you're in your house.
Yep.
I mean, what is better than that?
Yes.
You can play a game with the kids while you're waiting, just pop your head in, see if the doctor's ready. I think that's the ideal thing.
Yeah.
And one thing I like about the telemedicine on Anytime is, like, let's say, for example, we do our sick doctor's doing the telemedicines. She's has one patient waiting, and then our well doctor had a no-show, didn't show up. Now there's that 30-minute gap. If they have time, they can take over that telemedicine. We can reroute the call, and the pictures and the messages are already uploaded on there. So all we have to do is reroute the call. The patient doesn't have to redo the registration or do anything else. All we have to do is switch the clinician on there, and then they're ready to go. The doctor that now has the no-show can just hop on and do it.
Yep, that's the beauty of it. It's perfect. Yep.
So I think this is just kind of a great example of how you can help. Some people are using these in their EHR. Some people are using these really to kind of prep their patients for these telehealth visits. But as both Lydia and Mary Lou mentioned, talking about things like the pictures and the image upload and telling them what's going to happen during the visit really is helpful to having a successful visit and an effective visit, right? Once your patients have started using it, they're going to get really good, and they're probably going to ask to use it. But I think, you know, just kind of having some things that you can, as Mary Lou talked about, they have it on their website. There's just different places that you can put this information to make your visits go smoother for your patients and your providers, but also for your parents. So this last one is, I think, you know, when I talked on that very first slide, the last bullet was initial rollout, right? And so this kind of wraps it all together, because I think it's important also to understand, how are we doing, right? We look, as I mentioned, we look at KPIs all the time, looking at the number of visits you're doing each week or by provider. If you have a big practice, I know Mary Lou's got quite a few clinicians. You know, if you have one provider who's not doing a lot of telehealth, there could be a good reason that maybe they're struggling with the technology. Maybe they need a little coaching to help them. There's just a lot of ways you can take that data. One of the things that we do on the Anytime Premier platform is you can get a lot from your dashboard. You can get your patient feedback. We survey every patient after their telehealth visit, and they're talking about you guys. Now, they're not talking about us. They're saying, oh, I love, you know, Dr. Samuel, he's the greatest. Or they're, you know, they're just telling you what they're giving that feedback. So that's a great way to use telehealth. Not only to promote your practice, but just to give good feedback to your clinicians too. But, you know, it also helps you say, you know, if you get feedback, maybe it's a matter you're going to learn to give more education, or it's going to tell you different areas, maybe a parent was stumbling. But there's just a lot of different ways to look at KPIs, to take the feedback from the parents and your clinicians, and think about how to better use telehealth.
That feedback also helps with how you're scheduling the appointments. So like before, we were like a call with like a 10-minute appointment, like a 10-minute telemedicine. But then we started figuring out, like, does the patient have a history with asthma? Does the patient use an inhaler? Like, so now that 10-minute visit now extended to a 20-minute visit, because we have so many more questions to ask. Are they going to need a refill? So it really is like, the more telemedicines you do, you kind of start seeing what template you have to correctly use, and then how much time you have to get for that specific visit. So like a rash can be 10-minute appointment, but if we have a patient who constantly has a rash, or the rash has not gotten better, then we know, okay, this is not working because we already did a 10-minute telemedicine last week. Now we have to give this patient an extra 10 minutes and figure out like what really is the problem. Do they need to come in? And it just kind of helps. The more that you do the telemedicines, it kind of gives you a feedback of, am I using the right template for every visit?
Good, very good point. I think Darby launched our poll because we're getting close on time, but just a couple of things I just want to let everybody know is, one, we do offer a live interpreter as part of the Anytime platform now. We do have the app in Spanish. So for parents, they can use our app on their mobile, their tablet, or the computer in Spanish. But we also do offer a live interpreter. I would encourage anyone who uses Anytime, if they need something other than a Spanish interpreter, to let us know, because we need that feedback to know what other languages, because we have an option of 251. We need to know which ones of those 251 we need. So please let us know if your practice needs a certain type of interpreter. And then last, we'll give one quick plug. Anytime After Hours is coming. It's a really exciting offering to help practices with their after hours nurse triage. So we're really thrilled to talk to anybody about that. But I know we're at the very end of time, so we can do Q&A live, or we can do it in the chat. But I know I can stay on. I'm not sure about Mary Lou and Lydia because they are truly the experts. But if you have questions, we're happy to open it up. But as Darby mentioned, we appreciate everybody joining today. I really appreciate Mary Ann, Mary Lou, and Lydia joining. They are the experts, as I said, because they are using this every day. They are constantly figuring out ways to do it better. But we are thrilled that you guys could join. I know we talked when we were getting ready for this. It's crazy in your practices right now. So we really appreciate everybody taking their time, not only to present, but also to join. And as Darby mentioned, you'll get a recording of this tomorrow. So thanks everybody for joining. If you have questions, you can always reach out to the Anytime team. We'd be happy to forward them on to Lydia and Mary Lou. So thank you guys very much.